Hello, you're welcome to Little Angel's Corner, your favorite channel for parental tips on how to nurture your little ones right from birth till 10 years and beyond. My name is Dr. Stella. So, today we're going to be looking at the issue of frequent loose stools in your little ones. I'm sure some of you mothers have sometimes been confronted with this little problem. Well, not to worry, we'll thrash it out as much as possible today. To start with, when we say frequent loose stools, what do we mean? Well, the first thing is, what is normal stooling in babies? Normal stooling is when the baby passes 2 to 3 soft bowel motions in a day. Although for each baby it varies. However, when it's more than 3 and the consistency is getting a bit loose and watery, it's no longer normal. It's now called frequent loose stools, and in medical terms, we call it diarrhea. So now that we know what we mean by frequent loose stools or diarrhea, the next thing we'd like to know is, what are the causes? What causes this little problem? Well, I'm sure before I even say it, you already know. It's germs. Germs. And then when we say germs, what do we mean? We're talking about viruses and bacteria. Those are the commonest type of germs. So these germs we're talking about are just a part of the cause of diarrhea in babies. Then these germs, you'd ask yourself, where are they coming from? How come they got into the baby's gastrointestinal tract, the baby's gut? How come? Obviously, it's through poor hygiene. It's through using contaminated hands to prepare baby's milk. And for babies that are on exclusive breastfeeding, it's also through contaminated hands before feeding baby. It's also important to wash even the skin of the breast. So the causes, apart from germs, and the commonest type of germ, like I've mentioned, is the rotavirus. In greater than 70% of cases of gastroenteritis, that is diarrhea, the culprit is rotavirus, and it's self-limiting. That's the good news. It's self-limiting. Most viral infections are self-limiting. And then also bacteria. You talk of bacterial cases as well. It's not just viruses. Some bacteria are also major culprits in causing diarrhea in babies. We have other causes. We also have antibiotics. They also contribute to causing diarrhea in these babies. The reason being that most antibiotics are carried in what we call vehicles. That is, the antibiotics are embedded in a solvent before it is absorbed, given to the baby, and the baby absorbs into his system. This vehicle or solvents are mostly sugar-based. So the antibiotic may not cause a problem per se, but the vehicle carrying it may be sugary, and that is not good for the gastrointestinal tract of the baby. Aside from that, even the antibiotic, the active ingredient in them, also interferes with the normal flora of the baby's gastrointestinal tract. The baby is already living with some bacteria in its gut, and it's already living in harmony with the bacteria. So by the time you give antibiotics, you introduce antibiotics and it clears the normal flora, we now have this problem of diarrhea. So mothers should be very wary about just giving their babies antibiotic for any tiny reason. Then also the diet itself, that is the milk diet that the baby is taking, whether the baby is breastfed or bottle fed. Some babies are allergic to some constituents of milk. Some of them are allergic to the protein in milk. So the baby is likely to react to it. And how this manifests is diarrhea. Some babies also react to the lactose in the milk. That is, they exhibit diarrhea because along the gastrointestinal tract of the babies, we have enzymes that digest this milk product. However, if that enzyme is not there, the baby will present with diarrhea. So some babies also have a reduced level of this enzyme. Those babies are said to be lactose intolerant and therefore they will exhibit as diarrhea. So now that we know the causes, although there are so many others, but these are the major ones. A baby with diarrhea, like I've told you, would present with frequent loose to watery stools greater than 3 times in a day. The mother is frequently changing the diapers. Well, aside from that, there are other signs and symptoms, but we will not allow the baby to get to these other signs and symptoms because those signs and symptoms show that the baby has entered the complications, is now manifesting the complications of the gastroenteritis. The baby will have a sunken fontanelle. The baby, the fontanelle is this soft part in front of the baby's skull, in front of the baby's head. It usually doesn't close until about 9 months to 18 months. And if the baby is dehydrated from losing excessive fluid from stooling, the fontanelle is depressed. Also, you notice sunken eyes. The baby is crying but is not producing tears. And sometimes baby is quite lethargic, but we don't want to group that as signs of diarrhea because when you see such signs, that means the complications have set in and there is need to quickly rush the baby to see a doctor. That is the danger of gastroenteritis if it is neglected. Dehydration is a killer. So, other signs that you may see in a baby when the gastroenteritis is complicated and when you should see the doctor, the stool may now become blood stained, the baby may start vomiting, there might be accompanying fever. Please take to see your doctor. So, when your baby is having the gastroenteritis without these complications that I have mentioned, what do you do as a mother to make baby comfortable and to reduce the frequency? What you could do, continue feeding the baby. If the baby is on breast milk, continue feeding the baby because gastroenteritis means the baby is losing a lot of fluid from the gastrointestinal tract. So more breast milk will help. If the baby is no longer on exclusive breastfeeding, please give water, especially ORS, oral rehydration solution. They are sold in sachets over the counter. Just read the directions of the manufacturer and constitute the solution the way it has been prescribed. Give the baby as often as possible. Also, if the baby is already on cereal, you give the baby more cereals. Give the baby what he will tolerate, especially after passing a loose stool. Don't overfeed because that may lead to vomiting, but do give the baby 1 or 2 extra feeds than what he usually takes in a day. And then finally, there are some areas that I would like to point out that we should not do when this baby is having gastroenteritis so that we do not run into that complication of dehydration. If baby has been passing these loose stools for more than 24 hours and you've tried these measures that I have listed, I think you should see the doctor. Don't continue waiting. And then also, do not give antibiotics on your own. See your doctor. Most of the time, ORS will suffice and additional feeds. And also, before we call this topic, before we say we have ended it, nicely, it's good for us to remember that the major culprit of gastroenteritis are germs. Therefore, prevention is key, and that prevention is mainly um, hand hygiene, to observe 100% hand hygiene. What do I mean by that? You wash your hands properly under running water with soap. Do that before feeding the baby, whether breast milk or bottle feeding. Also, it's good to remember if the baby is on bottle feeding, after each feeding, wash the baby's bottle and the teeth very well with soap and water and keep. You can also use some antiseptics like Milton as well to wash babies feeding things, and then you keep to air dry. Some put in sterilizers and put Milton tablets. That is also in order. Then it's good to say at this juncture that baby also needs to be immunized. Since I've told you that 70% of cases of gastroenteritis is due to rotavirus, there's actually in the vaccination protocol, there's the rotavirus vaccine, which is given at 6 weeks, 10 weeks, and 14 weeks. Please see that your baby gets it. It will reduce the incidence, the frequency of gastroenteritis in these babies. Um, I've tried to cover all areas in this, and I hope you've taken home some messages from this. If your baby has gastroenteritis, never mind. Most of the time, it is self-limiting, except if those signs of the complications I've spoken about should come up. So just be rest assured, do what you can out of all I've listed for you, and then see your doctor if it gets out of hand. And it's very important to say, get your baby vaccinated. If you have enjoyed this video, please like, click the like button. Also, share and subscribe so that this message will get to as many mothers as possible, so that together we'll grow a community of informed mothers with healthy babies. And don't forget, if you have any questions, please put in the comment section. I'll be sure to respond. See you in my next video. Bye.